Hi, my name is Sahar, and I'm going to be teaching you all about meningitis. So what is meningitis? Well, meningitis is an acute inflammation of the protective membrane surrounding the brain and spinal cord known as the meninges. This occurs when bacteria enters the fluid surrounding the brain. The two primary types of meningitis are viral or bacterial. Viral meningitis is fairly mild, with symptoms similar to the flu. It mostly occurs in children younger than the age of 5, but is almost never life-threatening, with a recovery period typically between 7 to 10 days. Bacterial meningitis, on the other hand, is much more severe, with death in 10 to 15% of cases, even with proper treatment. The bacteria that cause this mimic the human cell to invade the human system, and is then spread through the exchange of respiratory secretions. Meningitis affects the central nervous system, which is made up of the brain, spinal cord, and nerves. Inflammation of the brain and spinal cord is very dangerous, as it can affect every part of your body. The brain and spinal cord act as the integrating and command centers of the nervous system, interpreting incoming sensory information and issuing instructions based on past experience and current conditions. There are 3 specialized cells that meningitis affects. The first are afferent neurons, which carry the nerve impulses from receptors towards the central nervous system. These neurons control your senses. Efferent neurons carry the nerve impulses away from the central nervous system to effectors, such as muscles or glands. These control your movement. Therefore, meningitis can affect these and cause poor coordination, clumsiness, and even arthritis. The third and final specialized cell is an association neuron, or interneuron. These form connections between other neurons to convey nerve impulses between various parts of the central nervous system. Meningitis affecting these neurons can cause poor communication throughout the body. Below are a few symptoms that a patient will face when affected by meningitis. There is fever, poor appetite, light sensitivity, vomiting and nausea, intense headache, and a rash. Symptoms more specific to babies are again fever, constant crying, irritability, poor feeding, and a bulging fontanelle, which is the soft part of a baby's head. The likelihood of long-term effects depends on the type and severity of the illness. Some of the effects are memory loss, clumsiness, residual headaches, deafness, epilepsy, paralysis, muscle spasms, speech problems, a loss of sight, permanent scarring from the rash, and in the most severe cases, amputation is also a possibility. So there are a few diagnostic tests that are used to check for meningitis. The first is a blood test, where the blood samples are monitored to see the growth of any bacteria. The second is diagnostic imaging, which is things like X-rays, CT scans, and MRIs, which are used to show the swelling in the meninges. However, the radiation is harmful and can cause cancer. The third is lumbar puncture, which is a procedure in which the needle is inserted into the back to collect cerebrospinal fluid. And some of the risks of this procedure are headache, back pain, bleeding, and in most severe cases, brainstem herniation. So the treatment does vary between the different types of meningitis. For viral meningitis, as I mentioned before, it is fairly mild compared to the bacterial meningitis. It cannot be cured by antibiotics. However, bed rest, fluids, and over-the-counter painkillers usually do the trick between 7 to 10 days. Bacterial meningitis, on the other hand, requires immediate treatment, and intravenous antibiotics and corticosteroids are used. There are a few side effects of corticosteroids, such as clouding in the eyes, swelling in the legs, high blood pressure, memory problems, mood changes, weight gain, thinning of the bones, bruising skin, and an increased risk of infection in the long term. So that brings me to the end of my presentation. Thank you so much for watching.